My name is Betsy Glosik. I'm a patient advocate with Society for Integrative Oncology, and I'm also part of NCCS's CPAT team. I'm really glad you're here and curious about integrative oncology and how it can help with a cancer journey. When I was diagnosed with breast cancer and treated back in 2008, I wanted to know what else I could do to help myself. I needed a sense of empowerment. And that's exactly what integrative oncology gave me. We didn't have that term at the time, integrative oncology, or at least it wasn't well known. But what it entails is looking at modalities that are researched, that are evidence informed, that we know have power, really, to help with our symptom management. And that's exactly what I got when I started using some of these things. What did I use? I used guided meditations to help me with anxiety, depression, sleep management. I also took a deep dive into diet and nutrition because we know, let's face it, that one of the side effects of chemotherapy is nausea, inability to eat with mouth sores, lack of appetite. So I really wanted to know what foods could I put in my arsenal that were easy to swallow, that would give me nutrition that I needed and help keep me strong. But the best thing for me was exercise, far and away. Exercise was another one of those things that helped with my mood and my sleep. We also know that there are cardiovascular implications with chemotherapy. And we know now that exercise during treatment really helps mitigate a lot of that. So, and I would joke with people and say that going to the gym was what little mental health I had. And who knew that exercise actually boosts our serotonin levels and is helpful with that. As I've gone through my survivorship, what have I added? I've added yoga. Not only is there a physical component of exercise there that's helpful, but there's also the mindfulness component in that. So that's been helpful. The other thing, as I've developed neuropathy from my treatment, acupuncture has been really beneficial to me to help reduce the symptoms of that. I'm really glad that you're here asking these questions here, but what I would suggest to you is moving forward, you ask questions of your clinician about what's available to help ease these symptoms with integrative oncology. Your doctor may not be familiar with it. You know, they're focused on utilizing chemotherapy and surgery. So if they're not sure or aware, ask the nurse. Maybe they know. Ask the navigator. Maybe they know. Keep asking the questions. Be persistent. These things are available. And you can also go to Society for Integrative Oncology's webpage for more information. It's just really helpful to educate yourself, empower yourself, and move forward. I really wish you the best on this journey. I'm really glad that you came here to ask the questions and get started. And I'm wishing you all the best in being well.